Ladies and gentlemen, thank you for standing by and welcome to the LA County COVID-19 update. At this time, all lines are in a listen-only mode. Later, we will have a question and answer session. If you'd like to ask a question on today's call, please press 1, then 0. I'd now like to turn the conference over to Supervisor Hilda Solis. Please go ahead.
Thank you so much, and good afternoon, and thank you all for joining us today on our daily press briefing. I'm County Board of Supervisor Hilda Solis, the Chair Pro Tem, Los Angeles County Board of Supervisors. I'd like to thank Dr. Barbara Ferrer, Director of the Department of Public Health, for joining us today. I also want to wish everyone a happy Cinco de Mayo. I also want to recognize that this is a particularly important month for us, May, because we're also celebrating Asian Pacific American Heritage Month in LA County. Did you know that there's 1.5 million Asian Pacific Islander residents that live in Los Angeles County? We use this month to remember and celebrate the heritage and contributions of our Asian Pacific Islander communities, whom at this time I believe we must uplift and stand with during these very hard times. Let us support all of our communities through compassion and solidarity. Today also is Givingtuesday, a global movement of generosity where people all over the world are united in donating to causes that they care about. It is in that spirit and the belief that no one should go hungry under this pandemic. And I'm pleased to announce that the Los Angeles County, at my direction, is allocating $3 million to the LA Regional Food Bank so that they can continue feeding our communities and our residents. I want to thank Michael Flood, the CEO of the LA Regional Food Bank, and his entire team and staff and volunteers for their partnership. Thanks to the Regional Food Bank, LA Regional Food Bank, we were able to serve, just this last week, 3,000 people in Baldwin Park on Friday. And recently, a few weeks ago, 8,000 families were fed in East LA at our Civic Center. Please visit lafoodbank.org to donate and also find a food pantry nearest you. Additionally, starting today, older adults who are interested in receiving meals through the county's Great Plates Delivered program can contact 211, who will screen them for eligibility. Our Department of Workforce and Aging Community Service, known as WEDAX, will work with restaurants and food service providers throughout the county to provide breakfast, lunch, and dinner to older adults through this program. Our intent is to target small neighborhood businesses through this initiative to stimulate our local economy. Restaurants and businesses that are interested in preparing food for the program can complete a form on the state's Great Plates website to ensure they meet the state's eligibility and nutrition criteria. In the initial launch phase, WEDAX will rely on the Hospitality Training Academy and Unite Here Local 11 and their network of hotels and kitchens. Through this unique partnership, WEDAX plans to provide 3 meals a day to 1,500 individuals across the county of Los Angeles. We anticipate meal deliveries to begin by next Monday. Again, if you're interested in receiving meals for yourself or a loved one through the program, please call 211 for more information. I also want to bring your attention to another opportunity to help us by donating blood. Right now, we're struggling with the national blood supply shortage. Unfortunately, COVID-19 has increased fears about blood donations. But please be assured that safety and infection control protocols have been enhanced. You can and should continue to donate blood. This is critical, and it does help save lives. Organizations such as the Red Cross are also looking for people who have fully recovered from COVID-19 to donate plasma for research purposes. I urge our residents to consider scheduling a blood donation appointment by visiting redcrossblood.org. I also want to take this opportunity to recognize that May is also Mental Health Awareness Month. Each year, we dedicate the month of May to educate our communities about the impact of mental illness on families and the importance for speaking up and asking for help. We must continue to fight the stigma. Our mental health is equally important as our physical health, now more than ever. So please take time to check in with your loved ones and family members. Let's stay physically distant, but socially connected. And if you or a loved one needs support, please feel free to contact LA County Department of Mental Health Helpline by calling 1-800-854-7771 or texting LA to 741-741. In conclusion, I also want to thank Los Angeles County residents for making the great sacrifices that they have and being an example to the rest of our state, our country, and the world on how to stand together during this crisis. I know many of you are eager to hear about the county's plan to safely reopen up our economy. And given the governor's announcement yesterday, we will have more to say on that later this week. Again, this plan is based on data and will keep the public's health top of mind. And now it gives me a great deal of pleasure to introduce Dr. Barbara Ferrer, our Director of Public Health. Thank you.
Good afternoon, everyone, and thank you so much, Supervisor Solis and the entire Board of Supervisors. LA County is extremely blessed to have such strong leadership and compassionate leadership during this unprecedented time. So, mil gracias. I want to update you today on our current status, and I'm sad to report that 58 additional people have unfortunately died from COVID-19. 43 of the people who died are over the age of 65, and 38 of the people over the age of 65 who passed away had underlying health conditions. 10 people who died were between the ages of 41 and 65, and 7 of the people in this age group who passed away had underlying health conditions. There was one younger person who died between the ages of 18 and 40, and this person also had underlying health conditions. Information on the 4 deaths that are reported by the City of Pasadena are available on their website, cityofpasadena.net. And this does bring the total number of deaths here in our county to 1,313 people. And that means that there are so many families today that are experiencing the pain of losing a loved one to COVID-19. You know, we're very much with you. You're in our thoughts and our prayers, and we share your sorrow. 93% of the people who have died from COVID-19 did have underlying health conditions. And those at high risk for severe illness for COVID-19 include people 65 years of age and older, people who live in nursing homes or long-term care facilities,